Hi, welcome to everyone joining us here today, whether you're here with us in Granger Hall on campus or you're watching online. My name is Kelly Tyrell, and I'm really glad to have all of you here joining us for our employee town hall. Today we're going to talk about where we are at this stage of the COVID-19 pandemic. I'm the Research Communications Director for University Communications, and since last March, I've served as a core member of our COVID response team. We're able to be here today in person. I know this event looks a little bit different than maybe some of those you've seen from us in the past, but we're here because of the remarkable speed at which scientists developed safe and effective vaccines and the incredible protection that those vaccines provide. As we'll talk about today, no vaccine is 100% effective all of the time, but an abundance of evidence from around the world shows us that being vaccinated is the absolute best thing that we can do to protect ourselves and to protect others. It doesn't mean we aren't still concerned. That's especially true for those of us with unvaccinated people in our lives or people with medical conditions that might put them at higher risk. And I'm certain that's what brings many of you here to our town hall today, to hear from experts in health, medicine, epidemiology, and public health. Before I introduce them and before we get started, I wanted to mention a couple of things. First, we are inviting live questions today. So if you're online or you're in the room and you have an internet-connected device with you, you can submit your questions by going to the following link: go.wisc, that's wisc.edu/August 12th. go.wisc.edu/August 12th. Second, I ask that you keep in mind that the people joining us on the stage today don't make campus policy. They provide their expertise to help guide it, but they alone don't determine it. Third, I want to thank our partners at McBurney Disability Resource Center for providing online captioning and interpretation services today. There are links listed in the YouTube event that you're watching today, and the video will be available to watch after this event concludes. Now, each of us have been here on campus at times since last March, some of us more than others, and some of us haven't had the choice. But this is the first time all of us are together for an event like this. It's really exciting to be here, but it's also sobering. Like many of you watching today or here in the audience, my life has changed dramatically since the onset of the pandemic. I know that's also true of the people you're going to be in conversation here with today. One of them is Carol Griggs, pronouns she, her, Director of Operations at University Health Services and a social and behavioral health scientist. Carol has a PhD in educational studies in diverse populations, and she specializes in health and well-being, particularly in higher education settings. Carol, welcome. Could you tell us a little bit more about yourself?
I think you covered everything.
Thorough, I aim to be thorough. Next, we have Ajay Sethi, pronouns he, him, an epidemiologist and director of the Masters of Public Health program, at the School of Medicine and Public Health. Ajay has spent countless hours providing nuanced, evidence-based information to decision makers and the public throughout the pandemic. Anything else you'd like to add, Ajay?
13 years have gone by and I'm at the university. I just had my anniversary for that, so it's nice to be here and here.
Congratulations.
Yeah, thanks.
It's a milestone. And last but not least, we have John Temte, pronouns he, him. Dr. Temte is a family medicine physician at the School of Medicine and Public Health, an expert in vaccines and immunization policy, and an expert in the public health of respiratory illnesses. John, thanks for being here.
And thank you so very much. And I'll just add that we've had the pleasure of running a study for a long time down the Oregon School District dealing with respiratory viruses in children. And that, coupled with my prior training in pandemics and a lot of vaccine policy, has put me kind of in my comfort zone with the pandemic, which I think is really unfortunate. I'd rather not have to use these experiences and background, but it is what it is.
Well, I'm glad that you can bring that expertise to bear today. Let's go ahead and get started. I know a lot of you have questions, and just a reminder, we'll be using that online link, go.wisc.edu/August 12th to take your questions. But we have some questions prepared, and they're questions that have come to us from employees across campus throughout the last several weeks. But maybe, Carol, we can start with you. I think a lot of us who got vaccinated, I personally got vaccinated as soon as one was available to me. This summer, like a lot of vaccinated people, began to resume a semblance of life that looked a little bit more like before the pandemic. But now it feels like things are different. Can you maybe talk about where we are right now?
Yeah, absolutely. So it is. It's a really weird place to be in for a lot of reasons because, throughout the entire pandemic, from the beginning of the pandemic on up through January, we embarked on public health activity to really reduce transmission of this virus. And that included social distancing, wearing masks, and all these things that we implemented that really contributed to kind of health behavior. And we needed to do that because we didn't have another tool in our back pocket to really prevent transmission of this virus. But then we had this miraculous tool that we can use. We had vaccines, and we encouraged people to get vaccines. Vaccines were rolled out based on this kind of tiered and phased structure because we really wanted to get the people that were at the highest risk vaccinated as quickly as possible. When you can offer protection to them, you impact the entire dynamic of the pandemic. So we did that, and we rolled out vaccines. More people were getting vaccinated as time progressed on, but we did start to see this dichotomy where some people were getting vaccinated and some people weren't. And so when you introduce a vaccine in this kind of life of this pandemic, that does have the ability to impact how much you actually will see this virus manifest and mature and transmit and even mutate. And so as we've seen that, we've seen these vaccines work, they do what they were designed to do. That is a good thing. And so we had this point in May that was kind of like this epiphatic moment where the CDC said, if you're fully vaccinated, you've done everything that you were supposed to do, you can resume activities similar to the way that you did before the pandemic. And we did that, but we still had enough people in our population that weren't vaccinated. And because of that, that potentially contributed to the Delta variant specifically being able to kind of take a foothold here in the United States. And so we started to see transmission go up again. And so it's not necessarily, I think it's important to really think about the fact that introducing a vaccine to the pandemic changes the pandemic. It changes how the pandemic works, but we're not out of the pandemic just yet, right? We have this tool in our pocket, and people that are vaccinated really, really do have the highest level of protection, but we still do have the possibility for some transmission because we still have some people that are unvaccinated. And so what that means is that as we progress along in time, there might be things that even vaccinated people have to do to increase the community health standard. And that's really where we are. We know that we still have a population of people that can't be vaccinated, children. And because we have them here and they can't be vaccinated and they're going back to school, as a community, it's really important that we do what we can do to reduce the number of hosts that this virus can jump around from. And so that's why we have masks on today. That's why it feels a little different. But we just have to remember why we're doing what we're doing.
Anything to add, Ajay?
The only thing I might say is that with the Delta variant, no matter how much we had vaccinated our populations in the U.S., there were too many people not eligible for vaccination, and the Delta variant would have been here no matter what. That we have borders in which people can cross, and it arrived here through travel, probably from Europe and other parts of the world, and it would have gotten a foothold no matter what. And so, like, sometimes when people want to blame unvaccinated individuals, for why we have the Delta variant, I think that's a dangerous assumption to make, simply because had everybody gone vaccinated, we would have still had children unvaccinated. Correct. And they would have been facing, the Delta variant, over everybody. And so that's all I just want to add is we would have been in this situation regardless.
Mm-hmm. Sure. Well, and that may be a good segue to talk about what we know about children and vaccination, and maybe, John, you might be able to speak to that one a little bit.
Well, certainly, I'm going to backtrack just a little bit. And if you look at the tapestry of COVID-19, it's really easy to think of it as just kind of a uniform presentation. But in fact, what we've seen since the very beginning is various variants coming in and replacing the previous one. And so if you look at how it manifests in illness, if you take a look at the United States, there was this huge peak that was really high in November, December, and came down. But there was a little bit of a rise in April and May, and that was largely due to the Alpha variant, or the UK, the B117. And that calmed down, and then we started coming back on up with the Delta. But so I think it's really important for people to realize that these viruses have this enormous potential to change. And it changes in a direction that allows it to be more transmittable. And sometimes, and we worry about this, that transmissibility might have something to do with being less responsive to the vaccine. So when we get into kids, and I think this is really, really important, as we look at the magical first week of September here in Wisconsin. And we can show that every year in Wisconsin, 1 to 2 weeks after school comes back in, we get an enormous rise of respiratory virus visitations in primary care clinics all across the state.
And you mean specifically in the K through 12 setting?
Well, when we get kids back, we see not only children in our clinics, but we see adults in our clinics. We're seeing everybody who is exposed to children who have this wonderful transmission going on at school. And I think what people are worried about here, and what we're already realizing in some of the southern states that have earlier beginning of the school year, is kids actually can transmit. Kids can actually get sick with this. Kids can end up in the hospital. And unfortunately, kids can die of this. The good news is it's only been about 450 children to date. But this is what we worry about in Wisconsin as people come back. And from our studies that we do down in the Oregon School District, we've been able to document 16 households that at least one person had. And what happens is most of the time, if there's one case, it's everybody. It's not like what we're used to seeing with influenza or other respiratory viruses, where some people get it in the household. But the typical situation is that most people or all people in the household, it's that transmittable. And so as we move into the fall, and as Ajay and Carol have said, we have this wonderful mixture of all these young people who don't qualify for vaccine under the age of 12 or 12 and above up to 18, that only 30% have received vaccine. And that's a lot of people who have not been exposed to COVID and who have the potential not only of coming down with this, but then bringing it home to their family members.
Yeah, thank you. I think in particular, maybe our audience is thinking about the return of fall as well. And so given these things, given where we are we have vaccination rates, we can talk about a relatively high vaccination rate among our campus community, but we are welcoming people back to Madison from all over Wisconsin, from all over the world. What does that mean for the fall semester? What I know nobody here has a crystal ball as far as I know, but what are you expecting? Maybe the three of you can talk about your expectations for the next maybe month or so here.
Yeah, I can certainly get us going, unless Ajay or John wants to jump in. I think it's fair to say, and to be clear, this would be something from a public health perspective that we would consider being in COVID or not in COVID. But I think it's safe to assume that for the first couple of weeks of the semester that we are going to see, as John stated, the emergence of upper respiratory viruses. We're going to see the emergence of, symptoms because people are in the environment, they're around more people than they've been around. And this is a particularly interesting year because we just went through a year of shutdown. And so not only did people not be around other people, but they weren't around the standard viruses that they would have been around. on a kind of annual basis. And so it's safe to assume that for the first couple of weeks that we will see the manifestation of that. And that's not abnormal. We want to do what we can to reduce that as much as possible, but that's certainly not abnormal. And so I think that would be at least my guesstimation.
Yeah, I'll say that no doubt life is going to return to indoors, in September, and that's going to cause the spread of all sorts of pathogens. And I think we're going to have a lot of people assume that they have COVID despite vaccination, and that's probably not true. I had a cold in July, and my thoughts did not go in that direction, mainly because of how I felt. I know I got it from my dad. I was visiting my parents. My mom didn't get it, and I could just have the feeling that it was going to be okay. And I talked to friends, and some of them have already been experiencing those summer colds. You should get tested if you have symptoms for COVID, but don't
Even
make
if you think you just have a cold, right?
Yeah, it's a good idea to do that, but don't make an assumption that somehow you represent a breakthrough case, because they are very rare. But yeah, I kind of see this fall as being a chance to, resume a lot what people are already doing, which is normality, but now being more indoors.
Well, and the challenge this all brings in, as my colleagues have pointed out, is we're going to see a lot more people with the garden variety colds. But what does that mean in the midst of a pandemic that also causes respiratory symptoms? And once we start testing more, we're going to find people who have the SARS-CoV-2 virus in their secretions, even though they may not be actively infecting people. The RNA from the virus can stick around for quite some time, and when I put a very powerful tool to use to detect it, I can find it. And it's going to create the potential for a lot of confusing cases, and because of that, we're going to see, the potential for isolation, quarantining, and so on. And so I think it's really important for us to be able to keep our eyes on what else is out there. And as Carol had mentioned, this is really an amazing experiment for us in respiratory virus biology, is once the schools shut down in March of 2020, influenza disappeared almost overnight. And most of us, Ajay accepted, have not had a cold in 18 months, which has been wonderful. And what we've seen at UW Health, for example, is our use of antibiotics for respiratory infections declined by 60-70% over this period of time. Why is that? Because the public health measures, the masking, the distancing, the hand washing, staying home while ill, all these things worked together in layers to protect all of us. And it's just been amazing. And as we start relaxing this, it opens the door for things to come back. And so one of the take-homes here is that we hope going forward that employees and students and everybody else will stay home when they're sick. We hope that the hand washing will continue, that especially if you're feeling ill, that you maintain your distance, and even consider wearing a mask during that time. And campus policy right now, because of the surge, the Delta strain, has reverted back to the use of mask as part of all the layers out there. So not one of these is enough to protect all of us, but together we can increase that protection.
Yeah, that's great. I've been thinking about, we're all back in masks again, and this idea is a layer of protection. I think some people have felt like it's a step backward, especially if you got vaccinated. You thought, well, this is my permission to take the mask off. And that was the environment we were in over the summer, right? But now with the arrival of Delta, we're learning that we should be taking these sort of layered protective measures for the time being. But it strikes me that knowing as a vaccinated person that my risks of contracting COVID and getting very sick from COVID remain significantly lower than they were last year when I wasn't vaccinated, that just simply adding a mask helps further lower that risk and takes, for me personally, the concern that I would unknowingly, have COVID and spread it to others, which was really one of my big concerns last year. But I think all of you mentioned we're going to be seeing an uptick in respiratory virus season. People are going to go get tested. We're doing entry testing for students in the residence halls as they're coming back. Do we expect we're going to see an increase in cases on our dashboard, and what should we make of that? How should we interpret that? Especially, I think, John, as you mentioned, if people are coming with, maybe past infections, and so there's some residual virus still in their nasal cavities.
Yeah, I think that what we can anticipate and expect is to see an incline on the dashboard. But we need to remember what that actually means. What we see, the numbers that we see as far as cases, that is really people coming to campus and using our test sites, and these are students, faculty, and staff, and these are people that might not have tested all summer long, even though the probability of them coming in contact with Delta is extraordinarily high. And so for those that are unvaccinated, they probably have already come in contact with this virus. And so if they have come in contact and let's say they did contract, let's say that they did not have symptoms, or they had really mild symptoms that they kind of ignored as a cold, or they just came into contact with the virus and their antibodies and their immune system did what it was supposed to do. Again, the viral remnants, the viral particles, the RNA that they have in their body, albeit dead, that PCR test, which is an amazing tool, will pick it up. And so we are going to treat that as an active case. We're going to have them isolate. We're going to have them do everything that we would normally have them do, even though that actually might not be a current infection. And so when people come to campus and you have a test site here, a test site there, and I can go to class and swing by a site and get a PCR test, or I just want to test because I was around this person in class and they look like they might have runny eyes, right? So I'm going to go get tested. It's amazing how many of those are going to get picked up. And so we will see the numbers go up. I would say that we need to caution ourselves and really kind of temper our emotions about that, because again, as John pointed out, that might not necessarily be an active infection that we're worried about.
Sure. Ajay?
Runny eyes, because I'll have a mask on, right? You won't know if I have a runny nose.
Touche.
But I think, I kind of think back pre-vaccine when we saw healthcare workers becoming infected. They weren't getting it at the healthcare facility. They were getting it out in the community where the PPE is more likely to come off and they have more of that contact with others. I kind of see campus this fall being very similar by having indoor mask use required and a lot of people vaccinated. If somebody tests positive, they probably got it, in their home setting, mm-hmm. In casual contact, when you're at a party or something, that's when they'll have it. I kind of see the campus being really on the safer side, because you're going to have a lot of people who are vaccinated with masks, taking precautions. And the transmission's occurring really outside.
Mm-hmm. Sure.
When I have to relate that to what we saw in many of our school districts across Wisconsin last spring, where they came back after a long time of virtual school, and they did not have the benefit of vaccine, but what they had was distancing, masking, and hand washing. And the district I'm most familiar with had zero transmission that was verified occurring during that period of time. And as Ajay has said, most of the transmission was occurring at home and was in the direction of adults to children. And so I think that's really important. On the UW campus at this point in time and going into the fall, most of us are vaccinated. And with that and masking, even though we don't have the strict spacing or distancing, provides a great deal of protection. Mm-hmm. So I don't anticipate that we're going to see the phenomenal increase that we saw last fall here, especially among the student body. But rather, we're going to see more activity, but it's going to be constrained. I also have to just toss out that since last August, we've been conducting surveillance of the UW faculty and staff, And we've seen incredibly low rates of transmission. And the reason being is they get it. Distancing, masking, and so on. And right now we're continuing through this fall. We have about 400 people enrolled. And as of yet, we're not seeing any transmission or anybody positive for COVID, though we are starting to detect rhinovirus and respiratory syncytial virus. So it's definitely out there. About 2 to 3% of our participants every week are symptomatic with cold symptoms, but it's not COVID.
Sure.
And just to clarify, when I made the comments about the numbers on the dashboard going up, that's really only referring to the first couple of weeks of school. And the reason I say that is because that's when people are going to be testing.
Yep.
And so that's when you'll catch them. And so I'm not talking about transmission with the numbers going up. I'm talking about catching people testing that first time when they get here and they just hadn't tested in 30 days. And let's say they had a really fun 4th of July. They might very much so test positive, and that might not be an active infection.
Sure. I think each of you have probably addressed this in a couple of ways, but we're getting some audience questions. Given that we have Delta, we're back in masks, we're not out of the pandemic woods, as it were. What is different about this year? Why are we resuming a lot of the activities that we put on pause last year? What's different now? How can we be assured that we're safer now than we were last year as we come back to these things?
Yeah, no, I would say that the major difference is that we have that vaccine and that we have a highly vaccinated population. And so if you think about that, when you look at all the people that we'll have on campus and the vast majority of people are vaccinated, that actually creates this idea or concept of nestled protection for the people that are unvaccinated, because you have fewer people on campus that have no protection. And so this semester and this academic year is going to be so different because we already have so many people that have made that choice to get vaccinated. And again, that offers community protection when they do that.
Yeah, definitely. This time last year, a lot of worry because we did not have a vaccine on the horizon. We just had to hope that it'd be out soon. And trial results were promising, but nothing was, authorized at the time. And a year later, it just is completely different. Really, in the spring semester, when more of us were becoming eligible for vaccination, that's when my confidence was, much higher that I was protected, and my behavior certainly has changed as a result. Much more willing to be with other people, especially when I know that they're vaccinated. I avoid crowds where I don't know sort of what proportion of people are vaccinated. And plus, I was just never a guy who liked crowds to begin with, so it's not very hard to adjust that behavior. But we have to remember that this remains a pandemic now of the unvaccinated. And if you're vaccinated, you're just not going to be contributing to the bulk of transmission that's occurring. It's mostly going to be people who have not yet chosen to get vaccinated, and hopefully they will soon.
Yep, and campus continues to offer free vaccination.
Absolutely.
John, anything to add?
No, I think I just have to reiterate that the vaccine was a game changer. By best estimates, by the end of June, it had prevented somewhere around 280,000 deaths in the United States alone, which is incredible testament to the science and to the safety and to the quickness at which this technology was turned into an actionable tool.
Technology that had been worked on for many years, including here at
decades,
UW.
yes.
Yeah. But then when push came to shove and we needed a vaccine, yeah, very impressive. As a science communicator, it was an amazing development to follow. I want to make sure that our online audience knows that we are providing translation and captioning through McBurney Disability Resource Center. So thank you to McBurney. You can find those links in the YouTube description. And we are also taking audience questions. So you can submit those questions at the link that's go.wisc.edu/August 12th. go.wisc.edu/August 12th. Speaking of questions and the fact that we were talking about how incredible it is that we have these effective vaccines that are allowing us to start resuming aspects of life that we really had to put on hold last year before we had vaccines. People want to know, why does UW not have a vaccine mandate like some other campuses in the U.S.?
Yeah, I think that when we think about vaccine mandates and policies, one of the things that we do have to be at least cognizant of is that UW-Madison as an institution still functions within an ecosystem, right? And so we have these other entities that we have to kind of work with in regards to policies and decisions like that. And so when we look at a mandate, though I think we could all agree that we want everyone to be vaccinated. When you get to the point where you mandate that and you make it not an option, that's a political decision. That's a decision that the institution has to make within this ecosystem that it functions within. And so, I certainly think, again, that we all want everyone to get vaccinated, but when you get to the point where you mandate, that's certainly something that's not within our wheelhouse to say that it needs to be done or has to be done, but I certainly would encourage everyone to consider vaccination.
Yeah, I think the idea of a requirement is pretty popular, right? And so as a result, I think it correlates with a high vaccination rate, because those are the very people who want others to be vaccinated. And I think, I believe in a requirement simply because it's safe, it's effective, and it's going to get us out of a pandemic. But I don't think my views are unique. I think a lot of people share that, and as a result, a lot of people are vaccinated. So UW Health, for example, already had a 90% vaccination rate among their healthcare workers before they decided to make it a requirement, just to get it up a little higher. But it's overwhelmingly popular to get vaccinated, at least in this area.
Sure.
Yeah, I agree. It's a challenge when you look at private versus public entities. Private entities have far more latitude in making a requirement. So I'm on the medical staff of both UW Hospital and St. Mary's, and I'm required, there's a mandate at both those institutions, but UW Health is a private entity. And so it's just the St. Mary's is a private entity. So it's within their wheelhouse to do so if they feel, and this is really true with many healthcare entities, that the benefit greatly outweighs any potential harm. And it's really important that we do everything in our power to assure safety for the most vulnerable people. And you know very well that in healthcare entities, you do have a lot of vulnerable people coming. So I think that's the approach. When we start looking, I think in K through 12 environments, that mandates have always been the purview of states. And in the state of Wisconsin, it's through an administrative rule process. And just because I've worked on these things before, this is never a very quick process. It usually takes 2 or 3 years to enact any new mandates. So across the country for K through 12, I doubt we'll ever see any mandates, particularly while we still have vaccines that are under emergency use authorization.
Sure. John, you mentioned, vaccination and mandates protecting vulnerable people. There are people who are vaccinated but maybe immunocompromised, and I'm thinking about UW employees specifically, and our students as well. But maybe they're immunocompromised and don't have the same confidence their vaccines are as effective, or maybe they're coming into work where their exposure might be higher than if they were working remotely, and they have immunocompromised family members at home or unvaccinated children. What resources are you aware of on campus that might be available to these kinds of employees? And I'm sure we can follow up with some more resources later as well. But what are some of the ways that UW is trying to look out for those people, and what are suggestions you might have for individuals coming back into this environment?
Yeah, so I can start us. So, there are a couple options. There are two pathways, really. So there's one where you can certainly speak with your divisional disability representative, your DDR, and your HR representative to talk through what those accommodations might look like or what that need might be. I think the other thing that it's really important for us to think through now, and I know that we are still in a pandemic, but it's really important to think through the fact that health behavior and our choices, the way that we think through how we respond to viruses and how we function when we're out and about, I think it's important to start to to normalize that in such a way where we adapt good personal health behavior. And I'm not saying that we're not doing that, but I'm saying that before SARS-CoV-2, there were millions of viruses, and there still are millions of viruses that are out there. And before the pandemic, in the United States of America, we did not have this robust educational network where we told people, you know, we're getting to this viral season, wash your hands, stay away from other people that are sick, don't touch your face. You know, we didn't really popularize that or put a mask on. We didn't popularize those things here in America, but those things have been popularized in other nations, and they work. They work to help you protect yourself. And the reason that I bring that up is because when we think of people that are immunocompromised and people that have lower levels potentially of protection, and they're going to be out and about in the environment, I think it's really important for you to pick those things up. Hold on to those things where you can. There is no problem at all if you want to put a mask on, right? Do everything you can to keep your hands clean and try to avoid touching your face. Like, take these things on not as things that we just did in the pandemic, but these are things that need to become part of the fabric of who we are. These are things that help us to reduce the spread of influenza and other upper respiratory viruses. And so I think that that's another component. So yes, talk to HR, but also think about some of the personal things that you can do on a daily basis, knowing that you're out and about, but still help to, you know, reduce your own risk of transmission of really any virus that you come in contact with.
Yeah, I'm just going to say that the FDA is days away from authorizing an additional dose for people who are immunocompromised, because they'll greatly benefit from that. So I think that helps us puts maybe their minds at ease that that soon they will hopefully have more immunity to this virus. And I'll just say that, you know, you never know who around you may be immunocompromised or be on immunosuppressive therapy. And this is why we're wearing masks. This is why we're all, you know, being good citizens in our community to do what we can to reduce the transmission of all sorts of agents. You know, by wearing the mask, by washing our hands, and those are just really important, good behaviors. It's a good reminder that we should have been doing it before, right?
Right.
Or more often.
Sure.
I couldn't agree more. At any one time, there are about 10 million Americans who are immunocompromised. It's about 3% of the population. And this can be from diseases they have, it can be from medications they're on. I'm always struck by the number of colleagues I have who are on immunosuppressant drugs, and anytime I happen to watch the evening news, all those medications that, when you look at the fine print, end in AB, are immunosuppressant drugs, and they're very, very popular and increasing quickly. But the best way, and I'm on the working group that actually just in the past couple days we're reviewing the additional doses for immunocompromised. And the way to look at that is not as a booster, but as an augmentation of that initial series to get you closer to the immunity that people with intact immune systems have. And so there are two things out there. One is this augmentation for immunocompromised, and then down the road we might be looking at booster doses depending on if vaccines wane in their benefit over time. You know, I'm now almost 7 months past my last dose, and we think that there's probably, with almost every vaccine, some waning that goes on. And that, coupled with the emergence of variants, we just have to keep this constant scrutiny going. Mm-hmm. And in the meantime, you know, as everyone else has said up here, those other things that are all within our bounds, the courtesy, you know, the staying home when sick, and I just have to say, as a physician, I am guilty. And the worst day of this, you know, I remember this is years ago, but coming to work, you know, having a high level of work fidelity. When I was sick with a gastroenteritis, and I remember stepping out of a room, you know, dealing with an infant, you know, in the first 14 days of life, having to run down to the bathroom to throw up and then come back in. Is that good practice? No. And I think it's time for all of us to accept that the status quo is not the correct thing, and better behavior can be expected across the board.
Yeah, we've been having a lot of those conversations in our office as we start returning as well. But that actually gets now to it. Thank you for sharing that experience, Jen. I'm sure it was not a fun day. Audience questions. Kind of want to know, given where we are right now, why is it important for us to come back? And maybe, John, some of this is informed by your work with the K through 12 school district, but at a sort of fundamental level, why not just stay remote, stay home, continue offering online courses until we get to some end of the road?
Well, we know particularly for the K through 12 is the benefit of staying home for virus avoidance is countermanded by the social isolation and all those things that go along with normal social development, particularly in younger children through adolescence. And one has to kind of weigh, it's not only a virus, it's not only the pandemic, but it's everything else going on. And those early years are so important. So especially again in the K through 12 environment, schools were very proactive, some last fall, but more particularly in the spring, of trying to get kids back together safely. And for the most, or to the most extent, they were pretty successful, particularly across Dane County, where they implemented get kids back, get people back person to person, but use that mask, use the distancing to our advantage. And that was really successful. I think the data also shows that wearing a mask doesn't have a whole lot of negative psychological or psychiatric effects. There are some individuals for whom masks can be contraindicated, but for the most part, we deal pretty well. And it's, part of normative behavior. If you go to school and all the other kids are in masks, you're fine. And I think we saw across the UW campus that was actually pretty good. And even as campus monitored mask use actually got really, really good throughout the year. So I think that's kind of why we need to get back together. I think, again, taking myself for example, it can be really a trap you get into, avoiding people and being less social. I've noticed, since the pandemic began, I've been going to my academic office, which is next to St. Mary's Hospital. But often, many days, I was the only person on a floor that would hold 100 people. And it's really important that we get out and reacquire our social skills and be part of a community. And I think that's such an important part of being human.
Yeah, that's a great point.
I would add to that too, piggybacking on what John just said, that I think it's important too to understand from a human development standpoint how significant that interaction is for the emerging adult. Students, they hit this point in time in life where they're graduating high school, they're coming to college, and that's an extraordinarily pivotal moment in their life where they figure out who they are. They figure out, at least they think they figure out where they're going. And they try to figure out what that next step in life is going to be. And when we develop this idea of higher education and we have campuses and we have all these things, it contributes to that developmental stage in their life. And what we do know is that the last year and a half of the pandemic has really had a negative impact on them in a lot of ways. Students feel it from a mental health standpoint. They feel that social isolation. They feel the negative impact on that. They're not able to focus. And even though they can learn virtually, we all can to some extent, is that the best experience in every case? And the answer is no, it's not. And there's no one scenario where something is the best or not. But what I'm saying is that when we think about human development, This is an extraordinarily significant and important time in their lives. And so we as a campus, what's our purpose? What are we here for? And our purpose really is to contribute to that stage in their lives. And so I know that there are a lot of anxieties about coming back, and I certainly understand them. I have a child at home that's not vaccinated, and so I certainly understand it. At the same time, I also recognize that students, they need this experience, even if they might not, if they might have their own fears and they don't want it in the same way. It really is something that's significant for their own personal development and well-being.
Yeah, I took a job at a university right when I finished graduate school because I wanted to be on a campus around a lot of people in a vibrant atmosphere that is academically stimulating, socially stimulating. Working at home during 2020, I certainly was very efficient in doing certain things, but I miss being on campus. And I don't really see it as, forgetting the things that we did in the last year to be productive and do things. I kind of see it as learning from that experience to optimize how we move forward as we get back on campus. And so, me and my colleagues, some of us are probably going to continue to do Zoom meetings rather than schlep out of the office and go to another part of campus, especially if it's raining. We'll do things differently, more efficiently, but being on campus also just, I think, means being around people, just being much easier to just pop your head in somebody's office, ask them a question, rather than deal with an email and get a response. Sure. I just see a lot of efficiencies moving forward.
Yeah.
Well, that just triggers me to think about those random encounters you have with people you work with that are so incredibly rich and valuable in your day. And that's something that I think all of us have been starving for. It's not, I can sit down and plan to have WebEx or a Zoom with a colleague, but it's very, very different just to happen to run into them in the hallway or outside at where bikes are parked or things like that, and have that 5-minute conversation, find out how the kids are doing or how our grant's coming along or things like that. And those are things that I think we are all just starving for. And so that's one of the other reasons that it's important to get back in a safe manner.
Yep, I have also been coming back to campus more often, and I keep saying, wow, I really miss the serendipity of being here. That said, Carol, I'm going to ask you, this is a hard one, and Andre, it might be a good one for you too, but are we being overly optimistic? There are people who are here and online who are still really concerned, and we've said a lot of positive things. If you're vaccinated, you're protected. We have a highly vaccinated community. We haven't really talked about testing, but we're talking about ramping up more testing for unvaccinated people on campus. What if you're still concerned? Are we being overly optimistic here?
Yeah, and my answer with that, and of course I would want Ajay and John to weigh in, but I would say no, we're not being overly optimistic. I would say that the state of how we operate in the pandemic, if you have access to a vaccine and you choose to be vaccinated, you have the highest level of protection. You are okay. And I know that it feels a bit uncertain because you're like, yeah, but there's still a virus and there are variants, and what about breakthrough, and what does that mean, and what if I go take a test and it's positive? But in reality, any vaccine that we've had in the history of vaccines, and I'm gonna ping John to correct me on this statement, but any vaccine that we've had, no vaccine is 100% efficient in the sense that it prevents all infection. I mean, there is the potential that you could have it, but the way that our bodies work when we're exposed to a virus is that we have layers of protection from these antibodies that we really get this boost from the vaccine on. So you're going to come in contact with the virus, right? But is it going to have the worst outcomes? Are you going to experience hospitalization or potentially death, right? And the answer to that right now is that these vaccines are efficient and effective in preventing that. And that's actually why you fear a virus. You fear a virus because of the worst outcome. You fear a virus because it can put you in the hospital, which overfloods the system, and then you run out of beds to help people, and then that results in people dying because they can't get the care that they need. And so these vaccines prevent that. And we have all of these other tools at our disposals that we can use to really try to reduce transmission. That's what we have. And so in reality, when we think about how we function in the world right now, if you've been vaccinated, you really are okay. yes, hold on to these other things, like wear your mask. I've been telling people that, wear your mask.
You probably won't stop wearing your
I'm
mask.
not going to stop wearing my mask. No, wear your mask. It works in so many different ways. Wash your hands. Why? We should have been doing that anyway. But, you know, for whatever reason, we might not have done it in the same way. Do that. Avoid touching your face. Do all these things because it is protection. But don't just stop when the pandemic, quote unquote, ends, which we're a ways away from that. The rest of the world is not as vaccinated as we are. And so I would say, no, we're not being overly optimistic. We have to retool how we think. Yes, there is still a virus out there, but we have tools at our disposal to really reduce transmission and to really reduce the worst outcomes. And so I don't think we're being overly optimistic. I think that we need to re-engage, but we need to do that and be mindful of all the tools that we have that could offer that highest level of protection.
Cautiously optimistic. And, you know, what I rely on is just paying attention to, you know, what proportion of people who are hospitalized and unfortunately are dying when we have this vaccine preventable disease, you know, what proportion of them are people who were previously vaccinated, and it's exceptionally low. That convinces me that I will avoid those terrible outcomes. And so I feel, you know, not just I feel realistic that I'm okay to do these things. And I'll say that every vaccine I've gotten in the past, whether it was required or because I chose to get it or was associated with travel, was because I was willing to accept then being exposed to that agent because I knew I had the protection. I didn't, if I had to go to another country and I got vaccinated for yellow fever, you know, I was okay with that because if I came in contact with yellow fever, I knew that I was protected. I wasn't going to then avoid travel because I got vaccinated because I didn't want to get exposed to the virus. I think we have to have that same mindset with this virus. You're protected. You have to be willing to now resume your life, and if the exposure happens, accept that this vaccine is actually really good, and that's why it's widely recommended.
Sure. Thanks. And John, unless you have something you're really dying to say, we're getting a little short on time. I want to make sure.
Sorry.
My colleagues have done such a good job. I am speechless.
Well, thank you. Some practical questions since we are coming back. There are questions about ventilation in spaces. What do we know about how to stay safe on campus and in various spaces if we're concerned about ventilation? And we can do this quickly, I think.
You ask hard questions to.
I know.
So it's not. I wouldn't say it's a hard question, really. I would say that organizationally, UW-Madison is constantly watching the ventilation systems in every building. Like it's something that we're always monitoring, and so we do have folks that are paying attention to that kind of stuff. And so I would say that for people that are returning, don't worry. Sure, you're welcome to voice your concerns. We do have a department that is looking at that, but again, I wouldn't worry. We are doing everything we can to ensure that we're bringing people back safe.
Sure. And we're not social distancing this semester like we were last year. What do we make of that, Ajay?
Yeah, I mean, it's not so necessary. And I mean, people will have their own sort of personal perceptions of risk, and by all means respect that. But for the most part, no. I mean, I think if you're vaccinated, you're really protected against getting infected and having symptoms and then getting hospitalized. You might have some of those things, but it's not going to be typical.
Sure.
So we can kind of go back to things as normal, but having extra precautions like wearing a mask, washing your hands, and keeping distance when there's an opportunity to do that, sure, it doesn't hurt.
Sure. We got a really practical question about events and the campus events policy. Can we feel comfortable, confident as a campus that we can hold larger events? What should people keep in mind as they're planning things this fall?
Yeah, I mean, unless John wants to answer.
I was just going to say that the most important thing here is the situational awareness. Mm-hmm. And where are we? So if all of a sudden we see things just blowing up in Dane County, we're going to approach things very differently than if we see things rise and then back on down. So I think most important is for everyone in the audience to realize that people are taking this seriously. People are keeping an eye on all the indicators out there and making rational decisions based on that.
Yeah.
Sure. Thank you. And I know we've talked about breakthrough infections a couple times. We've mentioned how uncommon they are. I think there was just some data from the Kaiser Family Foundation this week that showed in a number of states that are reporting breakthrough infections, fewer than 1% of vaccinated people are being diagnosed with COVID. By sheer number, because there are almost 200 million people in the United States vaccinated, 1% of 200 million is still going to be a number of people, which is why we're hearing those numbers. But I think it can be hard for some vaccinated employees who are coming back. They're vaccinated, but they're worried about picking up an infection and bringing it home to their children. What can we offer those employees for guidance or reassurance?
Yeah, go ahead.
Well, I was just going to say, from our experience over the last year, it was the other direction, that people were not picking things up at work and bringing it back home, but rather picking it up at home. And this is for the UW community. Obviously, there are other workplaces that transmission is occurring. But I think across the board for people on the UW campus, we've seen a remarkably high level of safety.
And I would just add to that too. I mean, again, there are some things that we can personally do. I would encourage people, if your children have symptoms and you suspect that, you know, the symptoms, even if they're cold-like, I would strongly encourage all of the UW community to really get your children tested. And if they are positive, if you're not vaccinated, you really need to quarantine because you do have a household contact at that point. And so that's just something that we all need to be aware of. So often we disregard the symptoms of children as, you know, common colds and those kind of things. And I certainly know that in, you know, the light of the pandemic, we wouldn't do that, but that's just something to be aware of.
Sure. Do you know if there's going to be any kinds of flexibility for parents that need to stay home and quarantine with their children or care for sick children?
I don't know. I don't have an answer to that. I think that would definitely be an HR question. I would assume that it's similar to the previous policies that we've had if you do have a child that's at home sick. But I know that that's something that OHR would be able to answer.
Sure, and I know I would probably turn to my boss and ask him for some guidance.
Exactly.
Or my divisional disability representative.
Exactly.
But, okay, well, I think we are reaching the end here, but I wanted to make sure if somebody wanted to get vaccinated and they were a little bit hesitant, what might be your advice? And then where can they go to get a vaccine if they haven't yet?
Absolutely. So I would say that anyone that has a vaccine hesitance, those come in a lot of different ways and a lot of different shapes and formats. And I think that it's really important for people to weigh the pros and cons, right? Look at not being vaccinated, weigh the pros and cons. There's a virus out there that we know has had the capacity to put a lot of people in the hospital and kill a lot of people, and that even if you get infected with it, you could still experience reinfection. That's reality of the virus and being unvaccinated. And then we think about vaccinated, pros and cons. The con is that, or the potential con you could say is whatever your hesitance is, right? But the pro is that you then have done that one singular most important thing that you can do to prevent everything associated with being unvaccinated and living in a reality where this virus is. And I would just encourage people to really, really rethink the pros and cons and really consider the significance of what it would mean to be vaccinated, knowing that the world is starting again. Everything is starting again, and you will be out there in the world. So that would be my last words and advice.
Sure.
Yeah, I'll say that if somebody is unvaccinated, it's never too late to get vaccinated. And ignore people who want to blame you for the pandemic, because that's just negative energy that's unnecessary, frankly. We were never going to vaccinate everybody overnight. There's always going to be people who wait. And if you're one of those people, it's not too late. And you'll benefit from it because it's safe, it's effective. And it's kind of, now that we have lots of good data to show that it works so well, I'd encourage people to get vaccinated. If you need to get more information, there's lots of information out there through your healthcare provider, through trusted friends who have gotten vaccinated to walk through that decision.
And just 2 words, remarkable safety.
Remarkable safety. That's great. And I do want to remind employees who have not yet, and if you're a student employee in particular, if you have been vaccinated or once you are vaccinated, upload those records or authorize University Health Services to access your immunization records. That helps make sure we as a campus know just how safe and protected and vaccinated our community is, and that helps us make decisions. So thank you to each of our panelists. So very, very grateful to each of you here today. And thank you for everybody here, everybody watching online. I just want to emphasize we're all in the same boat. Each of us in this room and on this stage, we are all also employees of this campus. We are facing the same expectations, the same worries. We are maybe share some of the same eagerness to come back and emerge safely from this pandemic. So, and we're here today because I know each of the people on the stage cares very deeply about our campus, our students, our employees. So thank you so very much. I know this hasn't been an easy time. I'm hopeful that things continue to improve. May you all be safe and be well.